our NDSU land acknowledgement. We collectively acknowledge that we gather at NDSU, a land-grant institution on the traditional lands of the Oceti and Sakoan, Dakota, Lakota, Nakota, and Anishinaabe peoples, in addition to many diverse indigenous peoples still connected to these lands. We honor with gratitude Mother Earth and the indigenous peoples who have walked with her throughout the generations. We will continue to learn how to live in unity with Mother Earth and build strong, mutually beneficial, trusting relationships with indigenous peoples of our region. Presenting today, we have Allison and Jalyn, the practicum students with NDSU Counselor Education Program, and I'm just going to go ahead and hand the reins over to them.
Guys, so Allison and I, like Alyssa had said, we have a presentation for you on self-care and burnout. So I'm just gonna jump right in and share my screen with you guys. Okay. Let me know if you guys can see. And then
I can see it.
Perfect. Okay. So our agenda for today is introductions, and then we'll go into burnout first and do our activity, and then Allison will kind of take over and talk about self-care, and we'll do an activity, and then we'll just kind of plug NDSU, community counseling services, talk about wellness, and then we'll do self-care plans. So before I start with mine, I'm Jalyn. You can probably read my name, but I'm a grad student in practicum for counseling, having a lot of fun. But yeah, let's just get started. Okay, so what is burnout? First of all, it's defined by Maslow and Leiter in their 2016 article as a prolonged response to chronic interpersonal stressors. And a good point to note in that is that it is chronic. We'll kind of talk about this later, but you're kind of unlikely to wake up one day and say like, well, that's it, I'm burnt out. No, like there's no going back from it. It's kind of a slow progression. And it's really sneaky, which is why we talk so much about signs. A common example of burnout in action is a marked decrease in timeliness or quality of work that lasts long enough that it's not just something else going on, like you are sick and you're kind of recovering from that, or your workload is like temporarily pretty big and then it gets better and then you get better. It's going to be unattributable to all of those other things, but it is like a marked decrease in the quality or timeliness of your work personally. And then it's also important to note that burnout is difficult to generalize as it happens for different reasons across jobs and across people. It doesn't look the same for any one person as it does for another person, but I was wondering if you guys could think of some occupation-specific signs of burnout. So like someone in your same role, what's something that you might recognize as possibly burnout? You can speak up or put it in the chat. It doesn't matter to me. Negative outlook is a big one. We'll go into like the major themes, but yeah, a negative outlook is definitely a big one. We can move on. Okay, so how to recognize burnout. Again, from the same article, they defined 3 main dimensions, although Maslow, I think later on in his research, split that second criteria into 2. But first of all is overwhelming exhaustion. And again, that's kind of a chronic exhaustion that doesn't go away. Feelings of cynicism and detachment from the job. So like Dr. Danielson said, a negative outlook is a really big piece of it. You can't seem to find the same spark or passion that you once had for your job. And then a sense of ineffectiveness and lack of accomplishment. So not only do you have a negative outlook about what you're doing, you also feel like you're not doing it very well, which kind of piles on and makes things really hard. So I thought for this slide, I think it would be really helpful to identify some more like field specific or job specific examples of these main fields of burnout. So anybody can chime in, but do you have a job specific example of like evidence of exhaustion? So like something happening where you're definitely not having as much energy.
I think a big one for me is feeling like I just can't get out of bed in the morning and go do what I need to do. That's how I can tell that I'm pretty exhausted of the work that I'm doing specifically.
Mm-hmm. Yeah, that's a really good one. Yeah, I think for me, it's, I think of everything that I have to do in the day as one big lump instead of like, okay, I have to do this, then this, then this. It just like all kind of clumps together and ends up feeling really overwhelming.
Yeah, I would agree with you, Jalyn. I get really, I think, overwhelmed with how many tasks I have to do, and it just feels like too much for me to handle almost.
Mm-hmm. Yeah, feeling overwhelmed and paralyzed. Yeah, that's a big one. Um, yeah, lumping everything together, and then you do kind of end up in like this paralysis kind of thing where you have so much to do and you don't know how to start on it, so you just kind of sit there and you're just like in that cycle of I don't know what to do. Um, yeah, when the coffee doesn't work, like normal caffeination doesn't do what it's supposed to, and you just feel tired. Yeah, for sure. Um, yeah, if I can ask a question to Alicia, what are your normal coping strategies that don't work when you're really exhausted?
I'm just trying to keep like a regular sleep schedule, or you realize that your sleep is just kind of dwindling down to not much. And
Yeah.
you haven't figured out a way to, kind of get it back up there at a certain time or
Hmm. Yeah, for sure. Sleep is big. Um, okay, what about feelings of cynicism or detachment? Like you just really don't care about anything that's happening. I think in counselor education we talk a lot about compassion fatigue, and I think this is kind of where that one would fit if we're sorting them into domains, just kind of feeling like you have nothing more to give and like you're not making full contact with the moment anymore. Any examples of that? Yeah, it's a pretty head-on response. Dr. Danielson said that she responded about feeling hopeless that the situation would change, and so like it was hard to care about what action they would take, which is absolutely feeling like really like just cynic about like nothing is changing. I can't do anything about it. Yeah, for sure. Okay. And that also, what Dr. Danielson responded for that one kind of rolls into sense of ineffectiveness and lack of accomplishment. This one I feel like for me personally would be the most crippling. If I was really deep in burnout and I feel like I can't do my job, I can't make any sort of a difference, I think that would really perpetuate the cycle for me, and keep it going. Does anybody have any life examples feeling ineffective? Okay, can move on. The last slide that I have to talk about today with you guys is burnout risk factors. And these, I think it's important to note that like risk factors don't automatically mean that there's gonna be burnout or that you're burnt out or anything like that. They're more of a red flag or just something to notice. Yeah, Jenny just said wearing too many hats is definitely like when your workload is just like so all-encompassing. Wearing too many hats it definitely starts to feel overwhelming and like a lot. It's a really good one. But back to risk factors. There are, as defined by the citation at the bottom, Stefano Owunar Williams and Vimercati. I probably butchered that pronunciation, but those people at the bottom did a study in 2022 and identified some global risk factors that kind of affect everyone across professions, and that's heavy workload, long working hours, and overtime. So really just spending more time doing work and meeting expectations than maybe a human should. That's going to take a toll on anybody. So that's something to watch out for. And then they also identified some ambiguous risk factors. And what makes these ambiguous is they flex and change depending on the person experiencing them and the role that they serve in your job. So autonomy is one of them, degree of management, influence, and role of rewards. Before kind of going into what these might look like, I think you guys would have a really good input as like, what role does autonomy play in your job, and do you feel positively or negatively about that role in your job currently? I can start off with an example as a prac student. We are allowed to set our own schedule and kind of see clients whenever the clinic is open, which really helps with just scheduling everything else that I have to do in a day, but it also kind of allows me to schedule breaks and like manage my own workload. So I do really appreciate that about prac experience. Okay, we can move on. Oh, okay. Carol said a lot of externally imposed deadlines and not a lot of choice. Yeah, I feel like that one applies to a lot of jobs, and it kind of hits on the first two. You kind of don't have a lot of autonomy in there. So maybe less autonomy is a negative thing in that circumstance. And then there's like that heavier management influence of like, do this, do it now, which yeah, would probably again be a negative thing in that circumstance. So thank you for sharing. That was a really good example. So the next thing we have is a Mentimeter. Do you have the code, Allison?
Yes.
Okay.
I will type the code into the chat right now. And then I can also share my screen so that we can see the word cloud. All right, so you should just be able to copy and paste that code there. So 54414923 is the code. And then Jalyn, if you want to stop sharing, I'll share my screen quickly. And then there is also, can everyone see that?
Yeah.
Okay, Thank you. It looks like for a lot of people that being tired, feeling exhausted, that's a really big thing of kind of realizing that you are experiencing burnout. Lack of motivation for sure. Irritability. I think detachment is a really good one too. Just kind of not really letting yourself care about those things. It's really important to recognize for sure. All right, so let me stop sharing this. And then we are going to talk about self-care next. So let me share my screen for that. All right, can everybody see that? Awesome. So, as Jalyn and Alyssa said in the beginning, my name is Allison. I am also a counselor in training here in the NDSU mental health counseling program. I am also in practicum this semester. And yeah, I'm going to talk to you about self-care today. So the first thing I wanted to talk about is the NDSU Community Counseling Services. So we are located in Morrill Hall. It's a place for students to come to manage various issues such as time management, anxiety, depression, and burnout, which is what we are talking about today. And it's, so we can help with all of those things. It is free for all NDSU students. And then another nice thing about the clinic is that it operates on the academic schedule. And we are open Monday through Thursday, 10 to 7. And it's provided by NDSU counselors in training. So just like Alyssa, Jalyn, and me. So the first thing I wanted to talk about here is wellness. So wellness as a whole is kind of that overall well-being of a person. And includes 8 different areas. So the first area is physical wellness. That's the need for physical activity, healthy food, and sleep. It seems like sleep has been very important to all of you, and that's kind of something that might take the back burner when we're feeling burnout. And then the next area here is emotional. So that's coping effectively with things that might happen, which is also tied to, coping strategies. So those not working as effectively when you are burnt out. And then creating satisfying relationships is also a part of that emotional wellness piece as well. Another aspect is environmental, so being in pleasant environments. I know for me, if my apartment is a mess and it's not clean and there's dishes in the sink, that takes a big toll on my overall wellness, overall well-being for sure. If I don't feel comfortable and organized in my space, a lot of other areas of my life will suffer as well. And then the next one here is intellectual. So that's knowledge and skills. That doesn't have to be education necessarily, but reading, learning about other things is a important part of well-being as well for a lot of people. Another area is social. So that's connection, belonging, support systems. So friends, family, classmates, coworkers, whatever it may be. And then the next one is occupational. So I think when we think of burnout, we a lot of the time think of work, that we're burnt out at work. It doesn't necessarily have to be related to work, but I think a lot of the time it is. And so that's a part here, how satisfied you are with your job. If you are burnt out, that's going to take a toll on that occupational wellness area. And then the next one here is spiritual. So creating purpose and meaning in life. That doesn't always mean religiously or really it spirituality means what you believe it means for sure. And then the next area here is financial. So satisfaction with your financial situation. I know, especially nowadays, that has been really difficult for a lot of people. So yeah, those are the 8 areas of wellness. Does anyone have any questions about those? All right, let's move on to the next slide here. So next we're going to talk about what is self-care. A lot of people tend to think of self-care as getting your nails done, doing face masks, and for a lot of people that may be self-care, but it's important to think of it as not only kind of that extra stuff. So WHO, or the World Health Organization, defines self-care as the ability of individuals, families, and communities to promote health, prevent disease, maintain health, and cope with illness and disability. Which I think is really important because it's, at the end of the day, it's just taking care of yourself, not necessarily treating yourself. It can be small things like getting out of bed, brushing your teeth or your hair, putting on fresh clothes. But it can also be working on longer term goals. So eating healthy, exercising, working harder at work to maybe get that promotion, whatever it may be. And like I said on the slide here, self-care, doesn't always mean face masks, but it can. It can be whatever you classify as self-care, whatever makes you feel like you're taking care of yourself. Does anyone have any questions about that slide?
I don't have a question, but I did kind of want to reiterate, we read an article a bit ago and something about it stuck with me. It said, you're trying to create a life that you don't have to escape from for yourself. Mm-hmm. And so I think it is like a really important distinction. Like you can, like get your nails done and do face masks and take baths, and that's definitely part of it. But it is also just kind of maintaining your life in a way that you can be happy long term.
Mm-hmm. For sure. Yeah, does anyone else have any reflections on that? Alrighty, let's move on. So, self-care, I feel like nowadays more than ever, it's a really big topic. A lot of people talk about it, and I kind of just wanted to provide some research that informs us why self-care is so important to us. So, first of all, and it's the fourth bullet point here, it reduces burnout. It can also prevent burnout, which is very important to prevent those feelings of not sleeping well, being super tired, all those kind of symptoms of burnout that we had talked about previously that can be really debilitating. And it also reduces stress and improves resilience. It improves happiness. It increases your energy because maybe that sleep portion is more regulated, so you're getting better sleep. And then it allows you to create and maintain satisfying relationships. So like we talked about on the slide with wellness, social is one of the 8 areas of wellness. And so if you are taking care of yourself, it's easier to create and maintain those relationships with other people. And something I wanted to put on the slide here as well is this little graphic that says self-care isn't selfish. I think that's very important because for a long time, even I used to think that taking care of myself was selfish because I couldn't necessarily, be there for other people because I was spending more time on myself. But at the end of the day, it has made me a better person for other people. Yeah. All right, so we have another Mentimeter here. And the question this time is, what does self-care mean to you? So I will pull that up here, as well as the code. The code will be on this slide as well. So that code is 36175629. I see a couple on here that relate to that sleep portion of wellness. Some more physical wellness aspects. So, eating healthily, exercising, balanced diet. Some also relate to that social aspect of wellness, so quality time, healthy boundaries. Yeah, that all looks really good. Daily routine. right. Thank you everyone for participating in that. We just have a couple more slides here. All right. So next I wanted everyone to take a few minutes and create your own self-care plan. So make a list of self-care activities, new or ones that you have been participating in the past, for all the different areas of wellness that we talked about today. Like I said here, you don't have to include all of the different areas, but maybe just the few that are most important to you, and kind of think through those self-care activities. I think we'll take about 5 minutes to do that, and then we can reconvene and talk about it as a group. Alrighty. Looks like it's been about 5 minutes here. Would anyone like to share what they wrote about their self-care plan? And definitely don't feel like you have to share, but type into the chat or unmute.
I could say mine. I'm sorry, 1 second.
I can say mine.
Okay.
So I wrote that balancing time alone and time with friends, family has kind of been something that I want to focus on. Taking time in the morning to really get ready instead of just rolling out of bed and getting out the door. And then just eating like enough and at the proper times and things that are like not terrible for me.
Yeah, mine was kind of similar, Jalyn, of just like continuing with like a morning routine and making enough time for myself instead of like sleeping in too late and then feeling really rushed the rest of the day and really hectic. And so, just trying to be really mindful of that. And then just sticking to a budget, I think is really important for me, just for my own peace of mind. And yeah, I think spending a lot of time with quality time with friends and people who lift me up is really important as well.
Someone in the chat here said asking for help when I need it at work, / keeping track of workload. Yeah, that could, sounds like it's really important for that occupational wellness. Emily said, I also wrote down to make time for myself in the morning, enjoy a cup of coffee before the kids wake up. Yeah, that is really important too. And that's something I didn't think of before that. And I definitely would like to add that into my self-care plan. Yeah, does anyone have anything else to share or that they want to share? All right. Oh, looks like something came into the chat here. Blocking off time to go for walks and more yoga. Treating myself to a coffee shop coffee. Yeah. Yeah. Sounds great. All right. Sorry, 1 second here. Someone else said, make time to plan things and establish routines. Yes. That sounds great as well. So it looks like we have a little extra time here. I wanted to kind of open up the floor, kind of like we've been doing, and talk about maybe what are some barriers to self-care. If anyone wants to share. Perceived lack of time. Yeah, I think that fits into my life for sure. It kind of can feel like we don't have enough time to do those things. For example, waking up early to have that cup of coffee and just have a slow morning. Yeah.
And if you feel like you don't have a lot of time, then everything can kind of like sneak up on you and you get into that like overwhelming paralysis kind of state where you're not really sure what you can do.
Mm-hmm.
I just get like really tired, but then I know that the self-care will help me not be tired.
Mm-hmm.
And then it's just like a never-ending cycle of like I'm too
Mhm.
tired, but not wanting to do it and just like sinking further.
Mm-hmm. Yeah, I feel like I relate to that a lot. Feels like we might not necessarily want to do those things because we're so tired. And so kind of pushing that back.
There's some stuff in the chat, just saying no and then demands and requests from others. I feel like those two kind of go together. Yeah, knowing your own boundaries is definitely really tough. And I think it helps to kind of ground it in your values and like how autonomous you want to be versus helping other people. Whether or not that falls under your responsibilities, that's hard to tell a lot of the times. Not enough energy, motivation, self-care feeling counterproductive is also a big one. I think even just when we were talking about making time in the morning, when you're at a burnout level and you're exhausted, waking up 30 minutes earlier is going to feel like you're just going to put yourself deeper in the hole of exhaustion. And that's another hard choice where you have to decide what's worth it for you.
Mm-hmm.
Yeah. Anybody else? Okay, so how do we think that we can set some different boundaries to maintain our self-care practices? I think one that comes up for me right away is that saying no to people and understanding like I have enough on my plate right now, and I can't take on this additional task that you asked. Like I appreciate you as a person, but I can't do it right now. I'm overloaded. Knowing how to say that.
Yeah, I think with that too, it I mean, for me, I had to practice that a lot. I had to practice just telling myself that it's okay. It's okay to take that time for myself. It's okay to say no and prioritize, this thing that I already was planning on doing. So yeah, it can definitely be really hard and it's definitely a barrier to overcome, but really helpful and really important in the end. Dr. Danielson said schedule it in your literal schedule. For sure. Because I feel like we, as humans, especially those of us that are planners, we follow everything that's in our planner to a T. And so if self-care is in there, you can't skip it. Can't put it off. Mm-hmm. Anything else for that question? So setting boundaries to maintain self-care.
Mm-hmm. Yeah. Danielson said saying yes to the things you want and need to do. I think that definitely hits the nail on the head again, where it's like you're finding that balance between like, okay, I want to do this and I can, so I'm going to, versus I need to do this and I don't want to, but I know that it's going to benefit me in the long run.
Yeah. Yeah, so another question that I have is, how do you know when you need to change your self-care practices? How do you know when they're not working for you anymore? I think for me, it ties back to that burnout piece. I realize that I'm not putting in 100% to everything that I need to, and I'm super tired, and I feel like I just don't have anything left to give, really. And so I think then realizing that, sitting down and kind of reassessing, hey, what do I need to do? Yeah, Emily said, when you start to recognize the signs of burnout. Absolutely.
And even when the things that you're blocking in for self-care, like walks or anything else that you've put on your schedule, your self-care schedule, start to feel not as beneficial, or like they aren't filling your cup anymore, and you need to look maybe for something else.
Yeah. Or maybe when those things, those self-care practices that you had scheduled in your planner, and they start to feel like a chore, like, oh, I really don't want to do that right now. Like it usually doesn't make me feel better, or whatever that is.
Mm-hmm.
Mhm.
Yeah, not experiencing as much joy. Yeah, that one's hard, because kind of tying that into what we were talking about with like your activities not bringing you the same benefits that they used to, is like, do you not want to do it because you want to push yourself to get that other thing done, or do you not want to do it because genuinely that activity is not making you happy anymore? That's kind of hard to tell as well.
Mm-hmm. Yeah, for sure. Does anyone have any closing comments about self-care or burnout? So easy and so complicated at the same time. Yeah.
Found myself saying like, yeah, and that's hard, which is the worst answer because it doesn't really give you anything, but I think it just points to like, it's something you have to decide for yourself.
Mm.
Nobody can tell you or give you an answer.
Yeah. I think another thing too is it can like seep into other areas of your life, like without you even realizing it. For sure. Yeah. Stop sharing my screen here. Yeah, I just want to thank everybody for coming. It was so nice to chat with you all. All right, everyone, have a good week. Thanks, Emily.
Mm-hmm. You did it.
Hell yeah. Did literally everyone leave? It's just us two now?
Yep.
Oh. Right.